Hi, good morning, everyone. Glad you all are joining us for this QAP 101 webinar this morning. Today, the experts will demystify the process around the qualified allocation plan and discuss how health can be integrated into the QAP and other housing policies. We'll get started in just a few moments here. Just so you know, a few housekeeping items this morning. You can see us, but we can't see you. But you are an important part of this discussion this morning, and we want to make sure that we're getting to any questions that you might have about how best to integrate health into housing planning and policies. So please be sure to go ahead and let us know what you're thinking about, what questions you might have by asking questions in the chat, sharing things in the chat, or asking your questions in the Q&A. We will be recording this webinar, and we'll send out a link to everyone who registered for this webinar. Please feel free to share this with your colleagues and friends. So I'll repeat all of that in just a second here because we're having a lot of folks join us right now. Thank you so much for taking the time to join us for this QAP webinar this morning. Today, we'll be demystifying the process around the qualified allocation plan and discussing how health can be integrated into the QAP and other housing policies. My name is Serena Unrein, and I'm with the Arizona Partnership for Healthy Communities, which is managed by the Local Initiative Support Corporation, LISC Phoenix. We are co-hosting today's online forum with the Arizona Housing Coalition, and you'll be hearing from several housing and health experts around the QAP process. They'll be here to answer any questions that you might have about how to best give comments to the QAP and how to make sure that the health voice is heard in housing planning and policies. A few things to note before we get into the conversation shortly. You can see us, but we cannot see you. You are a key part of the conversation though, even though we can't see you. So please go ahead and let us know what you're thinking in the chat. Feel free to share resources and make comments. And please, please ask us any questions that you might have, and we'll be getting to as many of those questions as we possibly can during this next hour. We will be recording this webinar, and we'll send out a link to everyone who registered for this webinar. And the follow-up link or follow-up email will also include links to any resources that are mentioned by our experts this morning. Thank you for being here today. If you're here, I assume you already know how important housing is to health and how health can be an important aspect in housing as well. If you work in healthcare or any social determinants of health sector, you have a key role to play in providing input and making an impact on the QAP process. Our goal for this webinar is to help you understand the QAP process and how best to provide input. We have experts from housing and health here to demystify the process, provide their guidance, and answer your questions. I'd like to have each of our panelists introduce themselves so you can get to know them a little better. I'll start with our co-host from the Arizona Housing Coalition. We're joined today by the coalition's executive director, Nicole Newhouse.
Good to be here with all of you. I am the executive director for the Arizona Housing Coalition, where we're working to lead efforts to end homelessness and advocate for safe, affordable homes for all Arizonans.
Glad to have you here. Thanks, Nicole. I'll have Keon from the Arizona Department of Housing introduce himself.
Good morning, everyone. I'm Keon Montgomery, the Assistant Deputy Director over Housing and Community Development for the Arizona Department of Housing.
Thanks, Keon. Josh, would you like to introduce yourself?
Yeah, good morning. I'm Josh Hahn. I'm with Poker DeYoung Architects Engineers, and I am actually a member of the Arizona Housing Coalition. It's been a great industry and group and partner, and I just had a wonderful forum, actually. So happy to be here.
Great. And rumor has it that you're also a LIHTC developer. Is that right?
No.
Oh, sorry. LIHTC expert, maybe. Sorry.
Sure.
Okay. We'll get to what LIHTC is later. Sorry. That's why we're doing these intros. Even I'm learning things. Terry.
Hi, everyone. Terry Bonelli. I'm the executive director here in Phoenix for LISC, Local Initiative Support Corporation. I'm proud to be the managing administrator, I guess, for the Arizona Partnership for Healthy Communities. We were an initial founder of the organization, and happy to still be on board and managing and providing these webinars for everyone.
Thanks, Terry. And last but not least, Eric.
Thank you, Serena. Eric Marcus. I'm the Director of Social Determinants of Health for Blue Cross Blue Shield of Arizona Health Choice. I am also a longtime member of the Arizona Housing Coalition, so hats off to Nicole. I serve on 4 Arizona Health Improvement Plan committees, and I am a voting member of the Home Matters to Arizona Funding Committee.
So as you can see from these short intros, we have quite the panel of experts assembled this morning. So we're here to answer your questions, and we're going to go ahead and get started with the QAP process. And Keon has been kind enough to share his time to go ahead and explain a little bit about what the Qualified Allocation Plan is and how you can be part of submitting comments on the QAP. So Keon, I'll go ahead and pull up your slides and hand the virtual mic over to you.
Thank you, Serena. So I wanted to start this morning just by, I guess, a general overview of the LIHTC program as well as the Qualified Allocation Plan. And so when you hear the term LIHTC, that stands for Low Income Housing Tax Credit Program, basically. And the LIHTC program is considered to be one of the most important resources for developing affordable housing across the nation. The program is governed by the IRS, and it was established. Sorry, Serena, can we go to the next slide? Forgot to prompt you. There we go. So the Low Income Housing Tax Credit Program, it was established in 1986 as a part of the Tax Credit Reform Act. And so the program is governed by the IRS, and the purpose of the program is to draw investors to the affordable housing industry by providing a dollar-for-dollar tax credit subsidy. So market rate housing is built by developers with the purpose of generating some sort of cash return, whereas affordable housing doesn't generate as much of a cash return, and there's less incentive to be a part of it. By establishing the tax credit program, investors, for example, could provide $8 million toward the development of an affordable housing complex and receive roughly $8 million in tax benefits from the federal government. And those tax benefits are received over a 10-year period of time. The program provides 2 distinct subsidies as part of the tax credit program. They're known as the 9% tax credit and the 4% tax credit. The purpose of the 9% tax credit is it's meant to generate roughly 70% of the capital that's needed to develop the affordable housing complex, whereas the 4% tax credit is used to generate roughly 30% of the funding needed to develop. So the 9% tax credit program is by this nature of the way it functions, more popular because it produces 70% of the capital that's needed. So the 9% program is generally very competitive, whereas the 4% program may not be as competitive depending on what state you're in. And that's because it only provides 30% of the capital needed to develop. So where does the QAP come into all of this? Well, the QAP is the Qualified Allocation Plan, and each tax credit allocation agency or agency that's approved to allocate tax credits for their state is required by the federal government to produce a qualified allocation plan. The plan is basically a set of guidelines or regulations that each state can implement that tells applicants who are interested in the program what's the eligibility criteria to apply, what is the scoring criteria that you'll be used to compete against, as well as what are the ongoing requirements needed in order to maintain compliance with the program. So the QAP is really a significant document that guides how the program is administered within each state. So here in Arizona, we're going to go over some of the details as to what our program requires or how our program is used to score and allocate tax credits. I also wanted to cover with the 4% and 9% program. So I mentioned the 9% program is competitive. Right now in the state of Arizona, the 4% program is not considered competitive. So those applications are accepted on a rolling basis. And with the 9% being the more competitive program, a good portion of today's discussion is going to focus on the 9% program. So as we go over these key components, I wanted to preface that with this pertains to the 9% tax credit. So some of the key components that you all should be aware of. The way we've set it up here in Arizona is that our tax credit program has set-asides. And the purpose of a set-aside is to ensure that developments of different types are competing against like-for-like developments. So for example, the new construction set-aside ensures that all of the projects in that set-aside are new construction because there's features that come with a new construction project that allow it to compete more apples for apples against the other projects. However, we've further divided the new construction set aside into metro and rural development. So the metro includes both Pima and Maricopa County, and the remaining 13 counties of the state are all wrapped up into our rural set aside. And again, the purpose is so that those developments are competing against like-for-like developments and have a better chance of having the best project within that set aside rise to the top. We also have a tribal set aside and a rehabilitation set aside so that those projects have their own pool that they're competing against one another for funding. Some of the most important aspects of the QAP goes into the scoring for the 9% side. How are we scoring these projects to determine who gets funded? And while the list that I've provided today is not an exhaustive list of the criteria for scoring, I wanted to highlight some of the criteria that might be most important to members on this particular webinar. So one of the key components is proximity to amenities. And so what we mean by that is we want to locate affordable housing next to as many amenities as possible. And so we provide scoring and basically elevate projects that are close to transit, close to a grocery store, close to a hospital, pharmacy, things of that nature. So resources that we know households need, we want these developments to be located close to those amenities. And the more amenities the project will be located close to, the higher the score it's going to get in this particular section. We also provide scoring for rental subsidy. So understanding that while these projects are meant to provide affordable housing, rents can still be quite a burden for some of the families that we are serving. And so projects that provide rental subsidy that helps those units to reach to a lower income targeted group are what we're looking to promote in that particular category and working to provide deeper subsidies to the residents of Arizona. Another aspect that we've highlighted in our QAP is community Wi-Fi. So we understand how important it is to have access to the internet and to have access to all the resources that come, whether it's telehealth or things of that nature. And so there are points that we provide for communities that are willing to provide Wi-Fi. And I do want to point out that because the 9% side is so competitive, every project that comes through commits to providing Wi-Fi. So we've received some feedback where we should make it mandatory that every development provides Wi-Fi. In a sense, by being a scoring category, every apartment complex that we fund is providing community Wi-Fi because they want to make sure they receive those points. And it's the same thing with smoke-free. We've established a point category that developers can receive points for making their communities smoke-free. And so that is something that basically every developer elects to make their complex smoke-free because they don't want to miss out on those points. Let me go to the next slide. And so why we're hosting this meeting today and your feedback is because the qualified allocation plan, which we use to govern how projects are awarded in Arizona, is updated basically annually. And so the department is in the process of updating our qualified allocation plan, and we're requesting feedback from stakeholders. So we released the first draft of the allocation plan at the end of August, and the second draft, we're actually working to release that later today. So that's going to be one of the first things that I jump on as soon as I get off this call, is making sure we're ready to go and get the second draft released to the public. So if it doesn't come out today, it'll come out tomorrow. And the public comment period is scheduled to end on October 15th for this second draft, and we'll go into producing what we hope to be our third and final draft. For anyone who's interested in submitting written comments, you can do that using the email that's on the screen now, the rental-qap@azhousing.gov. And we will also be submitting a information bulletin to everyone on our mailing list that provides this information, as well as a link where you can download the second qualified allocation plan draft. And with that, I will turn it over to Serena.
Thanks so much, Keon. And we'll be sure to share those links to both the QAP second draft and to places that you can submit comments with everyone who's registered for this webinar. So you don't have to go digging around for that. We'll be sure to follow up with everyone and send that out. I am going to just bring up a second PowerPoint here. All right, and thank you for that helpful background information. I'm going to have Josh hop in here because Josh has a lot of experience in providing advocacy on the housing side, and he's going to share how he sees an opportunity for people who are interested in weighing in on housing plans and policies to really contribute some thoughtful comments here. And Josh, I'm going to go ahead and hand it over to you.
Well, thank you. I appreciate it. And thank you, Serena. Thank you, Keon. I too wanted to provide just a little bit of an overview. I can move through these pretty quickly because Keon did such a wonderful job doing that as well. But figure it's probably good to kind of provide some background and context to better understand the confines of the LIHTC program, but also within those confines of the program, what public health professionals such as all of yourselves can do, to enhance public health among affordable housing and how that might be reflected in the QAP. So all of this, as shared by Keon, 1986, the low-income housing tax credit was created. It's an IRS program, which is an important thing to note. Tax credits are then allocated on a per capita basis, and it ends up being, pretty much the only housing production program that we have in our country today. My photo on the left is a matrix, and so welcome to the LIHTC matrix. Next slide, Serena, thank you. So also wanted to just provide a little additional background on some of the terminology that you will likely encounter in the QAP and in talking with others and what you will hear at ADO. And so just to highlight that, and most importantly too, to highlight how I think it should offer some context to the way you think about public health, right? So the QAP, as Keon discussed, there's 9% and there's 4% tax credits. I think the most important piece to understand here is that one is competitive and then one is not competitive. At least that's the case in Arizona. But three others, just to touch on very briefly, you'll see the term AMI a lot, and that's the area median income. And that's who affordable housing is reserved for, right? And these are the individuals and the families that will then live in affordable housing units. And I just wanted to bring to awareness. So many affordable housing units are reserved for individuals or families who earn at or below 30% of the area median income. So just to point that out, in Maricopa County, for example, I believe a family of four, that's just over $27,000 a year. So obviously not a lot of income. And so, of course, in thinking about how we design, how we build affordable housing, these are individuals and families of all different demographics that, we should be thinking about. The state tax credit, that's something else that Arizona has, which has really been an incredible help in generating far more units in Arizona than previously. And so that comes also with some different requirements and discussions, but that's important to note. And then typically, affordable housing units will be reserved for either seniors or families, and seniors here are defined as 55 plus, and family really could just be anybody for the most part. There are some restrictions on who actually cannot live in affordable housing, such as students, but could be, a single 25-year-old person or a family or a senior. So that's typically the two demographics to think about in terms of affordable housing. And I just want to point out too, if any of this is confusing or you have even more questions about LIHTC and what it means, I before this, I actually plugged into ChatGPT various prompts about, tell me about LIHTC like I'm a fourth grader, and it actually spits out some really good stuff. So definitely check that out. It could help. Next slide, Serena. Thank you. So your role, and I'm using the tagline from the recent Arizona Housing Forum, which is "Get Loud," and I think it's very appropriate here. So On this note, I wanted to kind of think about two things. So first and foremost, I say they only know what they know, right? So ADO, the Arizona Department of Housing, does a really great job at developing these QAPs and administering this program. It's an IRS program. It's a housing program. There are many different interests and issues that they have to take into consideration and account. So not everybody's an expert in everything. And so I think that it's important to note that your voice and your opinions and your thoughts and your experiences as public health professionals can only help generate greater thoughts and to take the QAP deeper and what affordable housing means and what public health and how that relates to design and development. So keep that in mind. The second is with regards to public health, to think about that. How is that implemented within affordable housing? And, you know, as Keon noted, you know, the QAP is kind of the book, the guide, right, for how projects are awarded, for example, on the 9% side. So how can then public health fit into the QAP? Is it via design standards? Is it via some of the requirements or the scoring commitments, right? And so how do these things interact? And, you know, not being a public health professional, you know, I just jotted down some ideas and thinking about ways to think about it. Is it the post-COVID world? Is it, you know, mental and physical health? Is it physical safety? You know, and a lot of this is, you know, finds itself in some things such as energy standards and sustainability standards, of which there are certainly a lot, and other requirements like that Keon noted, right? And there are other, you know, thinking about this in the form of green space. Telehealth rooms is actually something we've seen come up in other states that they are now requiring, incentivizing, or encouraging, you know, for public health or in the QAP. And then I had a link to something called the Trauma Informed Design, and POA is a nonprofit developer. They're actually out of Boston. I'm not sure if they work in Arizona, and they're an affordable housing developer. They generated this really what I thought was pretty impressive, immersive kind of design standard that they call their trauma informed design. I think, you know, you could say it's, you know, kind of a holistic public health approach. So I encourage you to check that out too, because I think there are, you know, public health can be holistic. And I think that I'm thinking about different ways to, if it's as simple as inspiring beauty and joy in a setting using natural materials, or if it's, you know, really in the design and more green spaces or balconies or telehealth rooms. I think there's a whole host of things, you know, that can be done and that you can think about as to how that interact. So that's my spiel, Serena. I think that leaves that there for me.
Thanks so much, Josh. And we'll be sure to share that link to the POA trauma-informed design in the follow-up notes as well. And I just really appreciate this background from both you and Keon on what the QAP is and how we can hear how people can start to contribute some comments. So to give some perspective from a health focus, I'm going to have Terry and Eric share their thoughts, since they're both deeply involved with the Arizona Health Improvement Plan and health in general. So Terry, why are you here?
Thanks, Sarita. Well, I'm co-chair of the Arizona Health Improvement Plan, and we've been concentrating our efforts since 2021 on social determinants of health that are directed at housing. And as we are checking in on ourselves and seeing which goals we've attained and kind of where we're headed for the next couple of years, we thought it was important to help our constituents understand the methodology around how we use federal funds here in Arizona to build affordable housing. And we also thought it was important to encourage people to help influence the process so that we have the most powerful outcomes of these federal dollars that we use in different systems here in Arizona. You know, Liz believes that our housing policy for the working class Americans lacks a coherent and well-organized political constituency. So we look to grassroots folks to help coalesce around the items that we want to lift up. Federal housing policy today ignores our most vulnerable and offers little for those on the fragile end of our lower economic middle class, outside of the low-income housing tax credit. Even our safety net health system Access is working to enhance and expand housing services and interventions for their members who are homeless or those that are at risk of becoming homeless. And we should be sure that the QAP, LISC feels that we should be sure that the QAP aligns even with what Access is attempting to do through their 1115 waivers. Eric Marcus of Blue Cross Blue Shield is going to talk about specific items to lift up and be included in our QAP. And it's our desire that the folks on the attending today will take a little bit of time to weigh in on how we can leverage the federal investments here in the state of Arizona to build people's health and well-being through housing. So Eric, I'll turn it over to you.
Thank you, Terry, and thank you, Serena. Let me start by just saying something that I think is really critical and underlines all of this. Housing is healthcare. It's that simple, okay? An extensive body of research demonstrates the strong relationship between affordable housing and health. Programs that ensure the availability of safe and affordable housing at all income levels will improve health, especially for the most vulnerable members of our society. And when we consider the qualified allocation plan, the QAP, it's important to recognize that there are two key elements for us to think about. One is eligibility, which is contained within the QAP, and scoring. How do developers get points that will set them up to be able to get these tax credits? Housing availability, location, design, and cost all work in concert to influence a range of health determinants, including household resources, family stability, stress, environmental exposure, and access to health supporting services. The QAP also addresses things like whether developments are in urban or rural areas, and provides set-asides, as were noted earlier, and also links, the current QAP links urban and rural projects, an issue that's currently being reconsidered. So this is an opportunity for you to weigh in on that issue as well. But all of these determinants contribute to health outcomes, such as heart disease, asthma, injuries. Further, health status can greatly influence an individual's success in school, career, and family. Deconcentrating poverty and revitalizing neighborhoods over the last several years, and more targeted efforts to steer affordable housing development towards areas identified as lower risk has literally saved lives. And we've talked about this program and how important it is. I can tell you that as of 2020, which is the last data that I have, LIHTC has provided $10.9 billion in tax credits. So these are really important areas to promote affordable housing throughout our state. And affordable housing investments improve health and quality of life, increase opportunities for all of our statewide residents. At Blue Cross, we measured healthcare claims costs of members 1 year before housing and 1 year after, and saw nearly 20% reductions in healthcare costs by just getting people properly housed. Housing quality standards are a prime example of how QAPs can be used to support health. Features of housing quality, such as heating, cooling mechanisms, non-toxic building materials, can lead to lead hazard abatement, have been associated with health outcomes and can be included in the QAP scoring. Some of the relevant environmental attributes that can be included in QAP scoring are proximity to a large number and variety of employment options, access to multiple convenient transportation options, convenience to stores, restaurants, parks, recreational facilities, healthcare providers, childcare, professional services, etc. Safety, walkability, bicycling, transit, clean, green, and well-maintained properties that are free of pollution, blight, and hazards. Stipulating that existing streets should not be abandoned, with surrounding street networks extending through the properties wherever feasible. Determining proximity by considering actual walking distance, not just straight line distances. Sidewalks, walking distances, ensuring that sidewalks are connected to adjacent streets, reducing potential exposure to air pollution. As an example, adjusting scoring to incentivize developments in locations farther than 650 feet from roadways carrying more than 25,000 vehicles a day. I know this sounds like in the weeds and technical, but these are the important issues that can make a difference in how livable an affordable housing project is. So at the end of the day, you have the opportunity to review and to offer feedback on the QAP. And along with all of our presenters, I encourage you to do so. Thank you. Serena?
Thanks, Eric, so much. I really appreciate the level of specificity and just the concrete examples that you provided for how people might be able to share their thoughts on the QAP. And just to emphasize this point, I'd like to have Nicole wrap up the panelist portion of this. So audience, this is your cue to start thinking about some of the questions that you might want to ask, because we're reserving most of the rest of our time to answer your questions. So don't be shy. Feel free to start typing your questions into the chat. But Nicole, why is it that you think it's important for people to provide comments? You're a housing advocacy expert. So just share with us why you think this might be important.
Well, the Department of Housing wants to do a good job and be informed as they are deciding how best to invest the dollars. And I think they are exceptional at soliciting feedback from all corners of our communities in order to ensure, as Eric had indicated, that they are really well informed and address all of the issues necessary in order to deal with housing and homelessness. So it's a really important thing for everybody to place comment because it's taken very seriously by the department.
Thanks, Nicole. I'm going to hop into the audience questions now. Don't hesitate to keep the questions coming. I'm going to make sure that we get to as many of your questions as possible for the remainder of our time together. And sometimes I'll go a little bit out of order. I like the question that just popped into the chat about how we can provide the feedback, because I think some folks, I've been seeing how many people are joining this webinar, and I know some folks had to join a little bit late. So I wanted to make sure that Keon had a chance to share how feedback can be provided. And one of the questions that I personally had was, how does ADOH prefer to receive comment? Do you like a 14-page letter, Keon? Do you like a few short bullet points? What's the most helpful type of feedback that can really drive these points home?
That's a great question, Serena. So the department has set up an email address that we can put back on the screen, I'm sure at some point, or also post in the chat. That's QAP at azhousing.gov. And essentially any questions that you have about the program or feedback you have for us can be emailed to that particular email address. And we have 4 staff that monitor it. So those comments are received and we then categorize them. But in terms of how we would like to receive the feedback, it's great if you can reference a particular section of the QAP. Right. So we have the QAP is broken down into various sections that are specific in what it's requiring. If there's feedback that you want on the scoring, let us know what section you would like to see that change made to the scoring. If there's something within a regulation, if you can let us know, in the particular section you have about set-asides, this is something we'd like to see. It helps us if you can give us a little bit of direction. Sometimes a broad comment becomes a little bit difficult for us to decide or figure out exactly how to then translate that into the QAP in a way that's going to be impactful. And so the more specific you can give us in terms of the sections that you're commenting on, the better.
Great, that is super helpful. And hopefully that also will answer the question that just came in the Q&A too, about how someone who is completely new to this can give feedback to the QAP. And again, we're going to share these slides and we'll get to all of these questions that are coming in. Thanks everyone for submitting them. We'll be sure to share these slides. We'll be sure to share a link to the QAP. We'll be sure to share the email address where you can provide comments in our follow-up emails as well. One of the questions that had come in earlier was about scoring and environmental criteria. And Keon, that's probably another question for you as well, but feel free, other panelists, to hop in. And this particular question wanted to know if environmental criteria was being used. And I think we could think about environmental both as sustainability, but then Eric had brought up environmental comments as well, both in terms of the environment being where we work, live, and play. So I think there's a couple of different ways we could think about the environment and how that's scored in the QAP.
Right. So I would start trying to address all three of those. I would say, while not a scoring criteria, we do have design criteria that are required. So any development that is submitted and approved has to adhere to the design standards that we have in the QAP. And so that speaks to some of what's going to be provided in the built environment, as well as how that development is designed. So green space elements would come into part in the design piece of it, as well as if you want to see certain community spaces, that all comes in on the design component. We also have the energy efficiency component, which that is a scoring criteria where we're incentivizing developers to provide energy efficiency measures as they develop, and that will translate over to benefits for the households as well. I'd say on the last one, in terms of more like environmental contamination or things of that nature, there are environmental reviews that take place, and the level of review depends on exactly which funding you're obtaining. And so if we have federal funding that's going into a development, there's a full-blown environmental review that takes place that takes into account, I want to say, over 30 different measures that will go in. So we're looking at, not just lead and asbestos type environmental aspects, but it goes into looking over flood zones, airport and air pollution, like the noise factor from airports, I want to say, as well as traffic and the noise factor from traffic. It goes into migratory patterns of endangered species. There's a lot that's looked into as part of that environmental review. And so the level of review depends on the exact funding, but there is criteria that's put in place as a developer who receives funding, but there's also just restrictions that are put in place at local levels for dust permits and things of that nature that have to be conformed with to ensure that environmental pollution is brought down to a minimum.
Thanks, Keon. I hope that answers the question about the environmental criteria. I don't know if anyone else wants to weigh in. I'll move on to the next question unless I see someone unmute. Okay. We've had a couple of questions come up just about the overall process of LIHTC. I think we have some folks that are newer to understanding how the low income housing tax credit program works. And so we had a question about what kind of housing properties specifically get the federal tax credits. What are the qualifications for a developer to apply for the program? And what does this process look like? Nicole or Josh or Keon, I'm guessing that you all might have some insight on the LIHTC process. Josh, I saw you unmute, so sure. you get to go.
Yeah, I'll take a first step. So it's a multifamily rental housing production program. That's number one. So it's rental housing. It's not build to own. This is for rental housing. And I think Keon, accurately described it and aptly described it, in his initial slides. ADO is one of 50 state housing agencies that allocate these tax credits, and that within the confines of what is statutorily required in Section 42 of the IRS code gets determined then how they want to allocate these and what the priorities are for the state of Arizona, as reflected in the QAP, and even further as reflected then in the comments and feedback and thoughts of all the various stakeholders in Arizona, housing advocates, public health advocates. And so the QAP really is a great place to start to see what it is, the type of housing that will be awarded tax credits. There's the competitive tax credits. There's the non-competitive tax credits. A significant piece of this too that I'm not an expert in is, obviously the financial component of this as well, and the underwriting of these projects. They have to make sense financially as well, and that's a huge piece, to this and to what ADO will review. Obviously within the confines of being a rental product and a rental homes and a multifamily property, and so that's a little bit. That's why I had that matrix on my slide. That is the real matrix to the whole thing. So hope that answers a little bit of it.
Yeah. And a follow-up question. Oh, sorry, I'll have you go ahead and answer as well, Keon. But there's also a follow-up question here about how many projects a developer can be funded for in a LIHTC round.
So currently, a developer can be awarded up to 2 projects. And part of the goal in that is we want to make sure that developers are monitoring their capacity. And if we award 5 projects to one developer, the capacity to bring that forward could end up in a very challenging position for that developer, which then we sort of all lose out if the housing doesn't move forward. And so we limit it to 2 projects per developer currently. And that seems to be working out pretty well to have a nice, I would say, dispersion of awards. And we haven't seen yet that developers have been over their capacity in terms of bringing those projects forward. The other thing I was just going to mention is to sort of dovetail on the previous question of how you get started with this. I would also say part of getting started is building your team, because these developments typically require a strong team in order to bring them forth. And so by that, you had to have an architect who understands the program. You're going to have some sort of financial advisor or attorney who understands tax credits and is going to help on running the finance side of it, as well as having a property manager who's strong and understands how to run and operate these programs once the units once they're up and running. And so it sort of starts with bringing forth a strong team. And as part of the application, we require that the applicant list out who all the members of their team are so that we can ensure that they have the proper players in place.
Thanks, Keon. And Eric, what would you like to add?
I just wanted to add something to Keon's last comment and sort of build on it for just a moment. Especially for people who are new to this area, you may be thinking qualified allocation plan. It already sounds way more complex than I'm going to be able to understand. Okay, and I want to really take my hat off, if I had one, to the Arizona Department of Housing. If you were to go back a couple of years and look at the QAP, it would have been hundreds of pages long, very difficult to follow. And the team that has come into Arizona Department of Housing has completely changed that. I think that the last document was about, and Keon can correct me, about 53 pages long. It's very manageable. It's very readable. It's well organized. So if you are new to this, you are going to be able to do this. You're going to be able to read it, especially if you're a healthcare professional, and understand it from a standpoint of what impact does this have on health, and be able to offer good feedback. So thanks to Arizona Department of Housing for doing such an excellent job of simplifying the QAP.
Thanks, Eric. And I know that you're speaking from personal experience as someone who works for a health plan and has cared about the QAP for a while. So thank you for that comment. We've gotten a couple of great questions about rural communities and how the QAP impacts rural communities. So I'd like to have Keon or Josh answer this next question. How is proximity to amenities measured, particularly in rural communities?
And so I've pulled up my second screen. I'm trying to scroll down in the QAP now to get the exact number. But I will say this, we have established for the amenities, when you talk about being measured, you have to take, we currently measure a straight line from a portion of the site. If you can get a straight line from a portion of that site all the way over to the amenity, that's how it's typically measured. And we advise folks to typically use Google Maps to try to ascertain what that distance is. And I want to make sure I'm not speaking out of turn, but I believe for rural projects, it's up to like a mile and a half that a particular amenity could be in order to receive points. Because we understand that amenities are not nearly as close as they would be in a metro area, but that's also why we have the rule set aside so that they're competing against other projects that have similar resources. And Josh, if you want to add to that, feel free.
Thanks, Keon. Appreciate that. And I appreciate the question too, and just the acknowledgement that what amenities look like and proximity looks like is very different in a rural area versus an urban area. We also had a really thoughtful question about end of life care. And Eric, I'm going to give you the heads up that I'll turn it over to you to maybe provide some thoughts. But COVID accentuated the need for end of life care services at home. And what are there any considerations for housing design to address end of life care, including palliative care, hospice, and telehealth? And do you have any thoughts on how that might be included in some QAP comments?
I'll offer a couple of thoughts, and then I'm going to give fair warning to Keon that I'm going to turn it over to him for real technical scoring questions, because I don't feel comfortable telling you what the scoring is. But I can tell you that there are considerations given in housing design. In fact, I think Keon mentioned one in his earlier comments about telehealth rooms, and that some states are in fact requiring these telehealth facilities to be able to make access to care better, especially when you're looking in rural areas. And we have rural communities in Arizona that don't have a single board certified specialist in some key areas. So how do we serve those people? And so telehealth has become more and more important, not just in COVID, but even prior to that. I can tell you that at Blue Cross Blue Shield of Arizona Health Choice, we pioneered telepsychiatry 33 years ago. And have been continually offering those services through telehealth. I think they're critical. In terms of palliative care and hospice, my certainly proximity to care facilities is a key part of the QAP and is something that's really important. In terms of specifics in design, I'm not sure. I'll ask Keon to give us his comments.
Yeah, so in terms of telehealth, we don't have specific requirements right now. The biggest piece is that we're trying to make sure that there is Wi-Fi and access to the internet available. That's pretty much the requirement that you see through the scoring. But we have not gone as far as to say that there has to be a space on site for telehealth medicine or for families to go to receive telehealth services. That's currently not in the QAP. But I also want to circle back to correct. So on the rural amenities, I was able to pull it up. We have actually gotten pretty broad on this to try to bring in a lot more sites. In the metro area, we're saying if you're within 2.5 miles of an amenity listed, you can get points. In the rural community, it's 4 miles. And for tribal land, 10 miles.
Thanks, Keon. Appreciate that. And Eric, I see you unmuted. What would you like to add?
Yeah, just one more thing. As Keon pointed out, it's not in the current QAP. That doesn't prevent you, if you think this is something important, from putting it in your feedback. That's what this feedback loop is all about. Let's let the Arizona Department of Housing know what's important to us, what's important to you. And if there are issues around telehealth or hospice or palliative care or anything else, if it's not in the QAP, that doesn't mean it can't be. It means that it could be considered if someone like you adds a comment and asks people to think about it. Thanks, Serena.
Thank you. I think that's such an important point, and that's how we can have these documents reflected to or updated to reflect Arizona's priorities, is by having all of us share our voices. Since I've seen some of the QAP questions kind of trickle off a little bit. And if I missed yours, I apologize. Please don't hesitate to retype it into the chat. If I haven't gotten to your question, it's not because I am ignoring it. It's because there are a lot of great comments and thoughtful questions being asked this morning. So please don't hesitate to ask again. But I did want to make sure that we talked about not just the QAP, but I wanted to ask Nicole to share her thoughts on what other ways are that we can advocate for health and housing beyond the QAP and make sure that our voices are being heard, not just in this next round of the QAP comments, but on an ongoing basis.
Well, thanks, Serena. I think Josh had stated in his slide that Arizona has a state tax credit as well. And that state tax credit is a 10-year credit that can be paired with the federal LIHTC. And it can be worth at least 50% of the amount of the federal LIHTC. So that's a sweetener that can help cultivate and create more units. And that is set to sunset, I think, in December 2025. So a way that you can help in this area is to advocate for the continuation of the state LIHTC program. As it relates to other things, in social determinants of health, we are convening in the next few months our legislative steering committee, and we'll be reaching out to create an advisory committee to turn the cube on these sorts of things. So stay tuned for both of those calls to action.
Great. Thanks, Nicole. Is that something that we could include in our follow-up notes too, so people know where to go to sign up and get more information?
You bet.
Great. Thank you. So Terry, I'm going to put you on the spot. And sorry, I haven't given you a heads up about this, but we've had a couple of questions come in about health equity. And there was a question about, is there a policy under process for helping to create an inclusive community? And I think one of the questions that's been on my mind this morning is, how can the QAP address health equity? So do you have some thoughts on how we might be doing a better job as a state to create inclusive communities?
You did put me on the spot. Thank you, Serena. It is something that LISC has been looking at for quite a long time. So we, I think going back at least 10 years ago, started to do health improvement, HIA, health improvement. I'm drawing a blank, you guys. If anybody knows what
health impact assessments.
Oh my gosh. And that was our way of kind of tracking and trying to follow to see what kind of outcomes we were getting when we were making changes in different, mostly developments, because that's where we did these health impact assessments. And I think it helped us determine some of the nuances that at one point were in the QAP, and glad to hear that some of them still are, around the proximity to amenities. Of course, transportation being one of them. When you're, 30% of your income is going towards housing, and you are on the lower end of the income spectrum, you don't quite have enough money to own a car, or maybe even own 2 cars. So locating the affordable housing closer to amenities helps those folks access the care that they would need, access fresh fruit and produce, groceries that are not just going down to the convenience store that happen to be close by, or even accessing jobs and getting into a financial coaching system where folks can help you get on a career ladder. That all falls into the health equity kind of spectrum. We've been, at LISC, we've been fortunate to be able to work with folks like the healthcare insurers that are supporting additional gap financing for affordable housing projects to make sure that these projects kind of get out of the ground as quick as possible. And that's another effort for us to be, honestly, to be inclusive and to get projects moving as quickly as possible. I noticed one of the questions in the chat talked about, don't all these qualifications like disincentivize, and that was not the verbiage that was used, but affordable housing developers. The amount of dollars that we put towards affordable housing in the country, and actually here in Arizona, will kind of never fill the needs for the amount of housing that we need here. 270,000 units was the last number that I saw, and I'm hoping that that number has gone down, but when so many folks move here every year, it likely doesn't go down. So we always talk about how you're not going to be able to build your way out of this affordable housing crisis that we have, that there's going to have to be other things that are being done. And that's why we love to work with Access. We love to work with the state health improvement plan, right? To put all of these things together so that 1 + 1 equals, 3, instead of 1 + 1 equals, yeah, we're back to the same old square where we started from, and we still need 270,000 units. In fact, we need more now. So all of those things I think we have to work together on. It is why I made the comment earlier about our thought process at LISC being that it's kind of a system that doesn't have a whole lot of political capital and is not as collaborative, I think, as we could be. But that's probably in a number of fronts here in Arizona and probably across other states as well. So working with, the Arizona Partnership for Healthy Communities, where we're trying to bring in a bunch of different sectors around the social determinants of health to address these, the issues that happen within our community. That federal dollars, state dollars are not going to buy our way out of these issues. It's just how we all need to work together.
Thanks, Terry. And I'm sorry for putting you on the spot, but you answered the question so brilliantly and answered another question that had come up. So, I'm,
it doesn't
grateful
mean you
for
can keep doing it, Serena.
Okay. Well, noted. Well, luckily we're almost to the end of our time, so you'll probably be off the hook. I think Eric also had a comment that he wanted to add, so I wanted to give him an opportunity to weigh in.
Thanks, Serena. Specific to the issue of health equities, which I think is a critical issue for us to talk about. I think it's really important. ADOH has held listening sessions, not just encouraged comment by email and by writing in, but actual listening sessions. I think there's another one still scheduled. Keon can correct me if I'm wrong, but I believe there's still another one. Here's what I would suggest from a health equity standpoint. Encourage people with lived experience to come to the listening session, okay? It's one thing for people who look like me, who might have a good idea once in a while, okay? But I don't come to this discussion from lived experience, okay? And for me to sermonize about what I think people with lived experience need is probably completely off base, okay? My best efforts are never going to get nearly as close as the comments from people who have true lived experience. So please, in terms of health equities, encourage people with lived experience to come to the listening sessions and make contributions. This is something that I think is really critical to provide the kind of input that ADOH needs on the QAP and in other areas. Thanks, Serena.
Thanks, Eric. And Keon, I'll have you chat about the listening session.
Yes, should have included that on the slide. So we will be releasing the second version of the QAP. And then this Thursday, I believe at 10 o'clock, we're going to hold another listening session. So there will be a link and an announcement coming out today about that listening session. And so anyone who would like to hear us go over the changes and sort of the rationale as to why certain decisions were made, you can hear it at that point. You can give us feedback at the end of that session, or you can provide the written comments. Written comments tend to, I think, work really well because it gives us a chance to really digest what you're saying. But during that session, there's also a time to provide comments.
Thanks, Keon. I will be sure that we include that link to the listening session and information about that in our follow-up email. I also wanted to do, I guess, a shameless self-promotion for a webinar that the Arizona Partnership for Healthy Communities and Arizona Housing Coalition are hosting next week on preserving communities and avoiding displacement. So we'll be able to continue that conversation about health equity and about what it means to invest in communities while we also preserve culture and the history of a place. So I hope that you all will join us again next week for some other thoughtful speakers. I really wanted to thank the Arizona Housing Coalition for their work on housing and their willingness to co-host this conversation today. I saw a couple of comments come in, comments and questions about housing choice vouchers and source of income discrimination. And I would encourage, since those are a little bit outside of the time that we have to discuss those this morning, I'd really hope that folks will follow up with the Arizona Housing Coalition and rely on their insight and expertise on these important topics. And I really just wanted to thank all of our speakers for their excellent insight and willingness to share their time. Keon, especially, thank you for sharing your time on a day when you're probably really busy releasing the second draft of the QAP. But thank you so much to you and the Arizona Department of Housing for the work that you do and for sharing your time. And thank you, Nicole, Josh, Terry, and Eric for sharing your insights about how we can all make an impact on the QAP and share our comments. So I really hope that you all will be submitting your comments and letting us know if there are other questions that you might have, and I'll try to direct those to the right places, but be on the lookout for a link to this recording and follow-up materials. Thank you all so much for being here today, and thank you, audience, for your thoughtful questions. Have a great day, everyone.